Good afternoon. Good afternoon, and welcome St. Petersburg College faculty, staff, guests, family, and graduates. The St. Petersburg College Nurses Association is proud to present this pinning ceremony in honor of the RN graduating class, December 11th, 2014. I would first like to thank everyone for joining us today. My name is Kristen Holmes, and I have the honor of serving as the Student Nurse Association President. Graduates Graduates, it has been a long journey, and you have come to the end of the first path on this long and winding road that is the career of nursing. Congratulations and many blessings in all of your future endeavors. Nursing school. When you dream of it, take action towards it, you will achieve it. Each and every one of you was so excited when you were first accepted into the halls of the St. Petersburg College nursing program. You were undoubtedly overwhelmed the first day you stepped into the health education campus for orientation. You proudly purchased all your books, blue scrubs, bright white polos, and scrub tops, maybe even a shiny new stethoscope, all in preparation for the new world you were about to enter. Day one, level one. So eager to get started, you arrived 30 minutes early with every book, every pen, the giant skills kit you had no clue about, lunch, snacks, etc., to make sure that you made the best first impression and start your journey. As the days and semesters rolled on, you may not have been as pressed and shiny every day, but your desire to learn your skill never faltered. One care plan after another, one sim chart and then another. Clinical rotations in med-surg, obstetrics, pediatrics, and maybe even an OR day. Let's not forget the clinical prep. And remember how all of these experiences have come together to help you become the great nurses you are today. You've made it. You're here. But before you step out into the world of nursing, I'd like to share the ABCs with you. No, not airway, breathing, and circulation. Not even providing for privacy, checking the patient's wristband, the doctor's orders, and washing your hands. A is for advocate, the one the patients trust. B is for believing in yourself. You know that you must. C, compassion for our fellow man, is what brought most of us here. D and E, the dynamics of healthcare will keep us evolving year after year. F is for Florence Nightingale, the woman who started it all. G, don't forget, God is in every hall. Possessing hope eternal, you are an inspiration every day. J, it's for jejunum, just because it's fun to say. K, knowledge. It's a quest we will never outgrow. Love is the truth that we all know. Multitasking. Need I say more? N is for nursing diagnosis, a better way to articulate. O, be open. Changes will always come. We are professionals who will get the job done. Watch the QRS complex. It tells the heart's tale. Registered nurses, you'll all soon be. And stay within your scope of practice while speaking therapeutically. For now, you've earned your undergraduate nursing degree, and one day you'll agree that your values, beliefs, and assumptions will help you share wellness with everyone that you see. X-ray your lifestyle. Make sure to keep it real so you can begin nursing with plenty of zeal. Nursing is one of the most trusted professions, and you are now part of that group of individuals who will willingly enjoy working holidays, weekends, long shifts, and even overnights to make sure that your patients' needs are met with a smile and a warm touch. The poet Maya Angelou said it best. I've learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel. Congratulations, graduates. Go forth into the world and make people remember your compassion and your love. I would like to make a few introductions and acknowledgments before we get started. I would like to introduce the Health Education Center Associate Provost, Dr. Nancy Kelly. The Dean of the College of Nursing, Dr. Susan Baker. Students are so fortunate to have these administrators by their side, to have an exceptional nursing program, and to help them be successful leaders. Thank you. Will the current Student Nurses Association officers please stand? Thank you for your commitment and time. Will the Student Nurses Association faculty advisors please stand? Our Student Nurse Advisor, Ms. Joanne Goot, and the Chair of the Student Affairs Committee, Mr. Jacob Schwab. Graduates, the obstacles that you have overcome were the intensity of your classes. No matter how tough the courses got, there was always a helping hand. Your peers, study groups, lectures by your dedicated instructors, and the New Initiative program helped you make it to this moment. I would like to take this time to thank the faculty and staff. Class projects, intense discussions, and constructive criticism have given you all practical experience that will guide you in the future of your accomplishments. Your faculty and instructors devoted many hours of their time, experience, and leadership over the years. Thank you. Family, friends, and loved ones, these graduates would not be here without your support, your love, and your encouragement throughout the nursing program. So please give yourself a big round of applause. We have a professional photographer here with us this afternoon who will be taking pictures of each graduate being pinned and will also be available for pictures following the ceremony. Now I would like to introduce and welcome our Dean of Nursing, Dr. Susan Baker.
Good afternoon. Congratulations, graduates. I'm sure you thought this day would never come, but here you are. Let me also congratulate the members of your family, the ones whose shoulders you cried on, the ones whose pockets you emptied during this time, and the ones who shared your joys as well as some of your failures. And we'd like to now give them the homage to which they are due. So if you are affiliated with any of these graduates, please stand and give yourselves a round of applause. As Dean of the College of Nursing, and on behalf of the faculty and staff, I'd like to take this opportunity to thank you for allowing St. Petersburg College to be the place where you've allowed us to educate you, to empower you, and we thank you for the opportunity. We are humbled and we are gracious that we have been allowed to do that. So thank you very much for choosing St. Petersburg College as the place to move your career forward. You've been on a long and arduous journey. I'm sure that you are so happy about this well-deserved break. And notice that I said break and not the end. You get a break from not having to complete drug cards. You get a break from not having to stand at the Pyxis and feel the breath of the instructor on your neck as you're pulling out medication. You get a break from the hours and hours of care plans. Again, it is just a break. I say that because your educational career by far is not over. You must study like you've never studied before for boards and passed on the very first take. And then prepare yourselves for the baccalaureate in nursing, which I'm sure you're all gonna move forward to obtain. And St. Petersburg College is the place you ought to do that. You are about to be inducted into one of the most elite groups that there is. Nursing is the most beloved profession that exists. You have had role models in your faculty, and I hope that we have served you well in that stead. Again, I offer you congratulations. We are so very proud of you. You make us look so good, so thank you for that. And as you move forward in your career, realize that you are going to be the voice for the patient that has no voice. For the families that are beside themselves and don't know which way to go, you're going to be able to provide that direction for them. Remember, to whom much is given, and you have been given a great gift, much is going to be required. And you're going to be required to be that advocate for the patient and that advocate for the family member. You will sometimes have to stand for right all by yourselves. Don't be afraid to do that. And don't be afraid to empower yourselves to be that change agent on whatever unit you may work. You have been given the tools to empower and to bring about change. Nursing is constantly changing, and you are going to be the agents of that change, and we only hope that we've given you everything that you need to get there. I also encourage you, as you start your careers, to find a mentor, someone who you can model your nursing behaviors after, and seek that person out early and seek them out often, and it will hold you in good stead as you move forward in your career. Congratulations again. Enjoy this wonderful day, and thank you again for the opportunity to be your educators. Thank you.
Thank you, Dr. Baker. I now have the pleasure of introducing our guest speaker for today, Pamela J. Markford, RN. Mrs. Markford was born in St. Louis, Missouri, and was raised in Nashville, Tennessee. She moved to St. Petersburg with her family and graduated from Pinellas Park High School in August of 1980. She received a scholarship to attend St. Petersburg Junior College, and that's where her journey began. She worked as a student nurse apprentice at Edward White Hospital, beginning in her 4th semester of nursing school. And in 1982, she received her associate degree in nursing and passed the state boards soon after to become a registered nurse. She continued her employment with Edward White Hospital for the next 7 years, where she continued her education, taking classes such as 12-lead EKG, interpretations, critical care nursing, and ACLS. Mrs. Markford used these skills in the ICU and the progressive care unit. This experience enabled her to be offered a position in the field of cardiothoracic surgery as a nurse manager for a local surgeon. Her responsibilities were varied and included assisting him in surgery, making rounds on the weekends, writing, admitting, as well as discharge orders for his patients, overseeing the in-office cardiac rehabilitation program, and monitoring and assisting with cardiac stress tests. Upon the surgeon's retirement, Mrs. Markford expanded her nursing skills by studying and working in areas such as oncology and hematology, becoming certified as a lithotripsy nurse, as well as working as a preoperative, recovery, and operating room nurse in multiple outpatient surgery centers. In 2007, she was hired part-time at St. Petersburg College in the New Initiative program as a tutor for the nursing students. In 2009, she was offered a full-time position, which she gladly accepted because it afforded her the opportunity to not only give back to her alma mater, but to also be involved in mentoring new students entering her beloved profession. Please welcome Mrs. Pamela J. Markford, RN.
Bear with me because some of what I'm going to say has already graciously been said. Good afternoon, graduates, faculty, friends, and family. I would like to express my gratitude for the great honor of being asked to speak here today, to celebrate with the graduating class of December 2014. As I look out with amazement at all of the friends and families of these graduating nursing students, it warms my heart. Could I ask you all to do me a favor? Anyone in this auditorium that's had anything to do with supporting these graduates, could you please stand up? That's right, faculty, nursing instructors. Woo! Okay. Now, graduate nurses, I know that you all would love to just show a little bit of appreciation to those here today that have supported you through this life-changing endeavor. So graduates, give them your enthusiastic roar. As you can see by the number of individuals who stood up, there is validity in the old quote that it takes a village to raise a child. Well, it takes a village and it takes a college community to raise a nurse. I would like to take a minute to acknowledge some key areas of our college community that have always supported your nursing graduate the many hours that they were away from your home and were at their college home. Our college community is very appreciative for the leadership of our associate provost, our dean of the nursing program, and I would also like to acknowledge the work, the care, the support of the many members of the nursing faculty, our instructors, and the nursing support staff. Other key areas that have supported the students come from the Connections Program Director, Dawn Janis, our learning specialist from the Office of Disabilities, Ms. Stephanie Silvers, and one last area I would like to mention that is very near and dear to my heart is the combined efforts of the New Initiative Program Director, Ms. Ann Nyberger, and Mr. Josh Brown, the Library Director. And we are now known as the Learning Support Services. I would like to begin briefly my story of how my spark for nursing started. I was fortunate at an early age of 7 to know exactly what I wanted to do when I grew up, and that was to help people when they were hurting or feeling ill. This early spark fueled my desire for the knowledge on how to care for others. It drove me to maintain high academic standards throughout my high school years, which enabled me to achieve a scholarship at the St. Petersburg College. In May of 1982, at the ripe age of 20, I achieved the same goals that you, the graduates, are achieving this momentous occasion, the nursing pinning ceremony. The college community further ignited my spark to become a nursing professional. My college instructors instilled in me the concepts of what it means to be a professional in both my employment and also in my daily life. One concept that has driven me back to my present position in the new initiative program is this motto: give back so that it can be passed forward. The theme of this statement was to give back to the new upcoming professionals so that they too would have respect and admiration for our profession. I will never forget to pay homage to the many instructors, professors, and mentors that challenged, inspired, and supported many of my core fundamentals that have made me the nurse that I am today. With these supporting mentors, I felt my torch was lit and that my career would grow. I can honestly say that I have been very blessed and I have loved the pathways of my career. These pathways have taught me many life attributes of this profession and to treat each client as an individual, a human being. My nursing journey started at a small local hospital, as you heard, Edward White Hospital, on the 11 p.m. to 7 a.m. shift. My official assignment was the orthopedic floor. However, you all know, as the new kid on the block, you are the first one to float from floor to floor. I had no idea how many bedpans I would empty, how many times I would gown up to care for an isolated patient while thinking, oh my gosh, all of my 5 other patients' call lights are on. At the same time, while another nurse was telling me, yet again, Mr. So-and-so just pulled out his IV, and of course, he has to get 2 units of blood on our shift. Lions and tigers and bear, oh my! I was in awe as to just how those seasoned nurses kept their sanity, and I wondered, how do they do it? But as time passed, I too became one of those seasoned nurses, multitasking. Hey, that was before that became vogue. Throughout this journey, some of my best friends and fellow nurses have offered me strength in my times of need. So please remember, graduates, to support each other and don't be afraid to share your burdens. When my best friend Diana Burgess told me about a job opening in the new initiative program at the college, I couldn't think of a more important way to give back as my mentors had done for me. It would be one way that I could pay it forward for our profession. Today, we are all gathered with one major purpose: to celebrate the accomplishments of these graduates that are embarking in their first steps in their nursing career pathways. So now soon students will stand and share the same pledge that many nurses before them have also recited as we entered into our profession. The Florence Nightingale Nurses Pledge. Hey, this pledge has responsibilities that accompany it, one of which I have never forgotten, and that our college community stands for. It is to never forget those whom have inspired, ignited, and sparked your enthusiastic glow in this profession. It is very easy to practice my instilled beliefs for this amazing profession at St. Pete College. On a day-to-day basis, we, the college community, support the educational, emotional, and humanitarian growth in our infant stage professionals. In closing, I would like to challenge our new graduates with the following. Are you ready? Okay. One last lecture, okay? Be the spark that ignites the flame which keeps our nursing torch of hope and compassion alive. If you accomplish this on a day-to-day basis, our profession will live on from one generation to the next. And always remember that caring, encouraging, nurturing, and inspiring those that are in pain, feeling hopeless and broken are our gifts to give. I recently had a loved one in a local hospital, and I saw firsthand how our graduates shine. I was so relieved to witness the quality and the caliber of care that those confident nurses administered. I can honestly say that these traits are evident when you interact with any nurse who has graduated from St. Petersburg College. Hold true to these truths when you interact with your patients, fellow colleagues, new upcoming nursing students, physicians, other members of the healthcare team, and especially your loved ones. If you pay it forward, just step back as you watch your flame begin to burn, and you will see our nursing torch will live on. Thank you.
Thank you, Mrs. Markford. That was wonderful. The pinning ceremony is a time-honored nursing school tradition dating back before the turn of the 20th century. Traditionally, nursing students have conducted a pinning ceremony to mark the passage from the student nurse role into the professional practice role. The student nurses are being pinned today by their clinical instructor as a way of symbolizing the welcoming of the student into the profession as a colleague. The yellow rose symbolizes life. The beauty of the rose is perfection. And the thorns represent the difficulties we've all overcome to reach that perfection. It also symbolizes knowledge, with the buds representing the students, as their knowledge is just beginning. The yellow rose is also a symbol of honor and loyalty to the profession, as well as joy and gladness. Graduate nurses, always wear your school pin with pride. Let it serve as a constant reminder, not only to yourselves, but also to your patients, of your desire, perseverance, and the dedication you have made to serve others. May I please request the presence of Dr. Susan Baker to the podium to begin the pinning? Faculty, please prepare to pin your students.
Mrs. Rhonda Anderson's clinical group will be penned by Mrs. Teresa Castillo. Christina Arundel. Giselle Barrero. Ramon Caraballo. Christian De Jesus. Diana Nolasco. Stephanie Wintang. Jesseline Fairbanks. Angelica Rivera. Christina Patches. Okay, so I got it right. Elizabeth Gintert. Danielle Lopp. Melanie Giardini. Mrs. Diana Burgess's clinical group. Carlos Diaz. Heather Ziegler. Jill Huffman. Megan or Megan? Megan Mouse. Edith Critelli. Phyllis Martin. Scott Carpenter. Diana Venegas Gonzalez. Janita Paraji. Rich Ruddock. Dr. Heather Chastain's clinical group. Patricia Grand. Jamie Miller. Teresa Giannoulis. Leanne Kunanen. Candace Pahusky. Elizabeth Roller. Twee Tron. Marlene Walker. Dr. Joni Esser's clinical group. Hi Ma. Sharna Lynn Paradowski. Christine Klopek. Landra Rogerson. Kristen Olivero. Ashley Foster. Kylie Smith. Aaron Freeman. Laura Anziani. Amy McDormand. Eleanor Moore. Julia Isaac. Mrs. Diane Jinks Clinical Group. Katie Rozier. Karen Bokulik. Yeah, thank you. Richard Thomas. Jessica Carr. Dawn Adamo. Jessica Guzman. Elizabeth Erickson. Amy Benoit. Mrs. Rebecca Keeney's clinical group. Sonia Hoshak. Tanya Asketh. Melanie Kent. Christopher Walton. Tuan Nguyen. Cheryl Hathaway Morgenstein. Tiffany Harris. Mrs. Sandra Kleiman's clinical group. April Cadmus Marsh. Nancy Combs. Conyers or Conyers? Conyers. Emaris Conyers. Yeah, what's your call? Tamika Nicole Davis. Tina Ligon. Kristen Odell. Trista Smoot. Crystal Tamero. Sade Nicole White. Mrs. Deborah Lauman's clinical group. Sean Hicks. Christy Bray. Joel Bancroft. Hepburn like Audrey, right? Hepburn like Audrey. Terica Hepburn. Michael Ledford. Samantha Hogue. Brandy Lee Kraft. Tomas Mokshevik. Jennifer Cederman. Miss Lauman is crying. Ashley Brown. Mrs. Jackie Murdoch's clinical group. Christine Lucier. Patricia Monday. Danielle Shad. Ashley Grindstaff. Giselle Pena. Rebecca Crow. Altina Musabelli. Mecca Scott. Jessica Bergen. Mrs. Christina Patterson's clinical group. Heather Karika. Teresa Conti. Todd Fixler. Kim Tran. Denise DeJarnette. Jasmine Denise Jenkins. Alyssa Kester. Betty Hahn. James Fincher. Mr. Mark Rupp's clinical group. Dominic Antonelli. Tiffany Humerick House. Stephanie Machin. Kim Joller. Kimberly Parker. Irina Shahai. China McCaffrey. Ashley Cooper. Ryan Ward. Mrs. Virginia Snyder's clinical group. Jennifer Warner. Michelle Farling. Elena Blondes. Shauna Adams. Elise Steffen. Catherine Zerwin. Taylor Harrell. Rafael Garcia. Nick Prenette. Oh yeah, it really is. Kyle Smith. James Franzen. Mrs. Helen Sharp's clinical group. Geraldina Nokai. Michelle Moran. Tiffany Martin. Ashley Hobson. Mary Kay Selby. Nicole Henn. Jenny Gum. Donna Hilton. Renata Vanderschaff. Asia Sancho. Mrs. Marla Sutton's clinical group. Stephanie Casey. Alisa Rail. Gesa Grimby. James Coleman. Allison Castro. Alex Roeder. Sandra Krakowski. Kamla Weaver. Carly Welling. Ms. Ruth Velasquez's clinical group. Megan Spencer. I held your baby, she's beautiful. Megan Tartaglia. Ashley Grimes. Ashley Allen. Ashley Sullivan. Jessica Antonio. Shay Martell. Lena Bianca. Gary Strickland. Nate Ferguson. That's right. Amanda Van Hook. Ladies and gentlemen, it's my pleasure to present the St. Petersburg College Associate Degree in Nursing Fall 2014 class. Congratulations.
Now, graduates, please stand and recite with me the Florence Nightingale Pledge. I solemnly pledge myself before God and in the presence of this assembly to faithfully practice my profession of nursing. I will do all in my power to make and maintain the highest standards and practices of my profession. I will hold in confidence all personal matters committed to my keeping in the practice of my calling. I will assist the physician in their work and will devote myself to the welfare of my patients, my family, and my community. I will endeavor to fulfill my rights and privileges as a good citizen and take my share of responsibility in promoting the health and welfare of the community. I will constantly endeavor to increase my knowledge and skills in nursing and to use them wisely. I will zealously seek to nurse those who are ill wherever they may be and whenever they are in need. I will be active in assisting others in safeguarding and promoting the health and happiness of mankind. Thank you. You may be seated. I would like to take this opportunity to remember the friends and family who could not finish this journey with us. To all of those we have lost along the way, in honor of their memory, let us offer this moment of silence. Thank you. Once again, On behalf of the Student Nurses Association, I'd like to congratulate the graduating seniors of December 2014. You did it. Yay! Following this program's conclusion, there will be refreshments in the fellowship hall down the corridor. Friends and family, please follow the ushers to the fellowship center. Your graduates will join you momentarily. For all of those who may wish, you may request a DVD copy of today's ceremony to be created for you. There are forms outside each door. So if you would like one, please fill one out and turn it into the box. Graduates, please remain behind for the group picture. And this concludes our pinning ceremony for 2014. Thank you all once again for coming, and congratulations.